All right, we're ready. Thanks.
Hi, everyone. Thank you so much for joining us for our MeBe webinar. Tonight, it's about speech sound disorders. My name is Hylan Noble. I'm our Associate Clinical Director of Speech Language Pathology here at MeBe, and I'm with our fantastic team of speech language pathologists. We have Bailey Byers and we have Chloe Lazarus, and they are both speech therapists with us at MeBe. They are fantastic. You might have seen them in our Carlsbad office. They work with a variety of populations and age ranges, and they both have extensive experience, in particular with kiddos with speech production issues, motor speech issues, apraxia of speech, phonological disorders, which we will definitely dive into this evening. So thank you so much for joining us. First, I want to start off by telling you a little bit about MeBe. So MeBe, people ask us all the time, what is MeBe? What does that mean? What is that name? MeBe is about being me. That is in its simplest form. We want all of our children to have a very unique and individualized experience with us. So we do integrate research-based strategies with that personal attention to provide therapy that's engaging, flexible, and customized to your child's needs. So it's very important to us and one of our core values to make sure that every child's experience is individualized to them and to your family as well. The services we provide are applied behavior analysis, ABA therapy, occupational therapy, and speech and language therapy. We also do have feeding therapy as well. So our occupational therapists and speech language pathologists provide feeding therapy. We also have a few ABA therapists that provide feeding therapy as well. So we're very excited to provide all three services. We actually now have all three services at our Carlsbad clinic. So we are expanding our Carlsbad clinic. We're super excited. We actually do have an open house event coming up on May 22nd in our Carlsbad clinic from 10 a.m. to 2 p.m. So if you are in the area, please look us up, mebefamily.com, and stop by. We also have all three of our services at our Kearney Mesa location and our National City location that we also recently opened. So our goal is to eventually have a learning center at every location that provides all of these integrated services. We thrive on collaboration amongst all of the different professionals. So that's something that I think is really special about MeBe. So as you can see, we are in a lot of locations. We are all across California. We're actually going to be opening up a center soon in San Jose, so in the Bay Area. We're opening up a center soon in Denver. We actually do have in-home ABA services at all of these locations. So we'll be adding speech therapy and occupational therapy as we build our centers. For now, we do have telehealth services as well in all of these locations. And we have those in-person speech therapy sessions in our San Diego offices as well. So yeah, check us out on Instagram and Facebook. We are always posting tips and tricks to use with your family, with your kiddos to work on speech and language, behaviors, occupational therapy tips. We do these webinars for you guys monthly so that you can come in and we can give you some strategies to use at home, which you will take home a lot of strategies with you today from this seminar. And you can contact us online. You can contact us at the number on your screen, and we are happy to answer any questions you have. So without further ado, I am going to turn over this entire presentation to our wonderful therapists, Bailey and Chloe, and we're so excited to have you.
Yay, thank you so much, Hylan. Okay, so let's just dive into it. So today we will be talking about what are speech sound disorders. What does that look like? We'll only talk about a few today, and then I will defer you to your speech language pathologist for further information later on if you have any questions. And then what sounds are expected by your child's age? How can these disorders impact communication? And how can we help? How can your SLP help? And some ideas for you guys to use and practice at home. All right, Bailey.
So first off, what is a speech sound disorder? So speech sound disorders, it's really this umbrella term just referring to really any difficulty here where a child might have producing one sound, many sounds, combining speech sounds together. Basically, do we have clear speech? If not, then we're looking at a potential speech sound disorder. So we have certain expected ages that we are thinking, okay, this sound hasn't come through yet. We were expecting it by this time. That's going to give us an indication that there may be a speech sound disorder present. So when we are thinking about all the different types of speech sound disorders, this again is not something that a parent is going to know or is expected to know. This is something that you would reach out to your speech therapist, and it's really their role to determine what group your child may fall into. So we have organic speech sound disorders, so they can either be present from birth or acquired at some point during their life. And we break down these organic speech sound disorders into 3 different categories. So we have motor, structure, and sensory. So if we start with motor here in the orange, some children have speech sound problems because the brain has trouble sending messages to the speech muscles, telling them how and when to move. So this disorder is specifically more related to apraxia of speech. So childhood apraxia of speech is the term that we would call it, and it's not very common, but it will cause speech problems. So that's more of that message from the brain to mouth. There's some sort of disruption there in that connection. Then when we're looking at the difference, we have children that might have speech problems because the muscles there that we need to make speech are weak. So this is going to fall under more of our dysarthria. So the term there would be dysarthria. So it's not necessarily a difficulty with connection. It's more of there's a weakness present. Then our other speech sound disorders that can be caused potentially by structural differences. So that's going to be our blue bubble here. So that's going to be some structural abnormalities there. For example, something like cleft palate, cleft lip, tongue tie, things like that are some examples that might impact their ability to produce specific speech sounds. Other structural differences can be caused by like acquired brain damage. So for example, seizures, a stroke, a head injury from a big fall, those things can cause some difficulties there with speech production. Then last, we have the sensory or perceptual. So this is typically relating to hearing loss, which may be present from birth, or it can be something that can be acquired. Maybe your child has frequent ear infections. Maybe they've had to have PE tubes put in. Those are some examples that they might have some difficulties perceiving their own speech, making it a lot harder to self-monitor or correct the sounds that are coming out because there's a difficulty with perception there. So that one's typically more related to the hearing loss or hearing impairment there. Now, if we go over to the other class, that's going to be our functional speech sound disorders there in the pink. There is no known cause for these functional speech sound disorders. However, they are going to be our more common. So this is typically the kids that we are treating in speech therapy. We're looking at articulation and phonological delays there. So we're going to kind of jump into those. Like I said, this is going to be the majority, the bulk of the kids that we're treating in therapy, although these other group of kids, these motor, structural, sensory, absolutely are present, but it's the less common. So we're going to focus more on these functional speech sound disorders today.
All right, so we'll quickly go over them. As Bailey mentioned, most of our kids fall into one of these 2 categories. So we'll start with just the phonological delay or disorders. So these are predictable rule-based errors that affect more than one sound. So some common errors include fronting, so where back sounds like K or G, so K or G are produced as T and D, like tat versus cat. Or we have like cluster reduction, like S sounds are left out of the words. So any word that starts with the letter S and another letter like ghoul instead of school. So these are kiddos that are usually really difficult to understand because these patterns affect multiple speech sounds at a time. But Bailey will explain and just provide more examples later on. Phonological patterns are different from articulation disorders. So these are classified as distortions and substitutions in the production of individual speech sounds. So meaning the error is likely based on a learned motor pattern or often treated differently from phonological disorders. So some common errors include frontal lisps. So like S or Z are produced as TH, so with the tongue tip sliding through the front of the teeth, or lateral lisps where the tongue is pushed to the sides of the mouth or the roof of the mouth, and it just distorts certain sounds, has a wet-like quality. And R errors are usually articulation disorders. But we usually see these around 1 to 2 sounds in error, and it's more common in older kiddos. So this often has minimal impact on overall intelligibility, so our ability to understand our child, but it's also often found in combination with phonological disorders, so leading again to low overall intelligibility. And I think Bailey will go over some of the phonological processes right now. Yep.
Yeah, so if you're thinking, okay, I can understand everything my kid says, but they're making their R's and it sounds a little funky. There you're kind of thinking more, this is looking like an articulation disorder. If you're like, I understand almost none of what my kid says, or I get about 50-50 chance here, then they're probably going to fall closer into that phonological delay there. They're looking like our younger kiddos, and their articulation typically, like we said, 1 to 2 errors. Oh, they're missing their R and then their, TH sound, something like that. That's going to present more like that articulation profile. So our phonological, there are a lot of the families that come in that are like, no one can understand my kid. Why can't I understand my kid? What's going on? That's going to be this phonological speech sound disorders. So we're going to talk a little bit about that. So phonological speech sound disorders, like Chloe mentioned, they're more like patterns. So every time we want to produce this back sound, which like K and G is pronounced in the back of our throat, they're not going back, our tongue's not going back, it's coming forward, and we're getting a T or a D there. So it's this pattern that's coming through. Now, all kids use these patterns. However, it's when these patterns don't stop and they keep persisting and they're getting older and older and the pattern is still present. So a lot of the common patterns that we may be seeing would be, subbing a W for an R. So I see a wabbit. That one that I talked about where these back sounds K and G are being pulled up to the front. We're using our tongue tip to produce a T or a D. So I want a tootie for cookie. A cat said meow. We're missing a sound there on the end. Are they dropping the last sound in the word? That's a pattern that, again, we see when they're young kids. These are typical developing patterns, but when they start to persist past certain ages, then we're looking at a speech sound disorder. So another couple more examples here. The pain is fying. So we're dropping sounds there. Instead of plane and flying, we're reducing those clusters. We call those consonant clusters there. So they're dropping a sound there. The monkey has a nana. We're dropping some of these extra syllables. So again, these are all common patterns that young kids use. And when it starts to become a problem is when these errors persist beyond the age of when typical developing kids have stopped using them. Okay. The other examples that are a little bit less common are when we see some errors that are not typical developing. So if we see them dropping the initial consonant in words, so if they're saying at for cat, that's not one that a typical young kid might use. So that's more we call maybe a deviant pattern. It's not a typical pattern. And so we're going to look at that child and say, okay, we're looking at a potential speech sound disorder here with a phonological profile. So I wanted to include some expected ages of elimination, because as we're saying, it's typical until a certain age. Well, the question there is, well, what age? When should these sounds be coming through? Typically, we want to see between 3 and 4 years old, we've eliminated almost all of these patterns. So that fronting that I brought up, where those back sounds are being pulled forward, we want to see that eliminated by about 3.5 years old. Stopping, so where a sound like S is being produced as a T, so ton for sun. So we're looking at, about 3 to 4 years here. So if we look at a couple of these different patterns, as you notice, about 3 years is a time when we're expecting these to either be eliminated or mostly eliminated, with a couple other later ones for example, gliding. So if we're producing a W for an L or an R, that's going to be a pattern that is typically eliminated by 6 years old. But if a 3-year-old is using a W for an R, we're not going to have some big concerns there yet, since they haven't really met that expected age of elimination.
Okay, so, and then on the other side of phonological delays, we have articulation. So then articulation disorders, we're looking for the average age of sound acquisition before we begin treatment. So in the, I guess the earlier developing sounds would be P, B, D, M, N, H, and W. And then, so then we start looking for the other developing sounds. It kind of goes in the same pattern as the phonological development as well, right? So then we have T, K, G, F, Y, and G, and then all those other sounds are later acquired sounds. So I won't read all of them, but you get the drift, right? So then we have all these other more difficult or more challenging sounds that come later. And so, but there's some things that we need to consider. So lateral lisps, like I mentioned before, they're never developmentally appropriate. So these distortions, again, are when it's on, it's a wet quality almost, most of the time, and it can be on any sounds, mostly Z, S, C, H, so ch or sh. So a child would benefit from receiving intervention as soon as possible, either way. So we're not going to really wait for them to come in at 4 years. We're going to start intervention earlier, around 3 years or 2 years. So then some things that we consider as a provider is a language disorder present? Are there oral motor difficulties like drooling, muscle weakness, poor coordination of the articulators? Feeding difficulties? Are there existing myofunctional deficits like mouth breathing or snoring present? So again, these are questions or guidelines that your provider considers when determining a treatment plan, so that they have necessary information just for the appropriate referrals if they need to.
So next we're going to look at speech intelligibility. So a lot of times the first time we say that word, people think, oh, intelligence. Well, speech intelligibility has nothing to do with intelligence. So that's a first distinction that I always like to point out, that speech intelligibility is really referring to the percentage of words that we recognize and we understand when listening to the child. So if you say, I get 50% of what they're saying, then their speech intelligibility would be 50% intelligible. So that's just a measurement that we use as speech therapists to determine if a speech sound disorder is present. It's one of many, just like Chloe mentioned on the last slide, that we're looking at, okay, when is this sound expected to come in? Okay, well, is there anything else going on? What's their intelligibility looking like? Are we looking at language as well? It's just a piece in the puzzle that it's not the parent's job to understand all these factors. It's our role to be looking at all of these things. So this is just another piece to the puzzle. So speech intelligibility, that's a measurement that we are looking at. So for parents, it's okay, well, how much should I be getting? So these percentages right here are how much of the child's speech you should understand as a parent, as a caregiver, as someone that's around the child all the time. You're very familiar with this kid. So you know what their speech sounds like. So at 18 months, you're expected to understand about 25% of what they're saying. 2 years, between 50 and 75% of what they're saying. 3 years, 75 to 100%. Now I also added on there intelligibility percentages of what we're expecting a stranger or a less familiar listener to understand. So see how they kind of drop down here a little bit to like 50% at 2 years, 75 at 3 years, and 100% by that 4-year mark. So if you're thinking, well, gosh, my kid is 3 and I'm understanding about 25 to 50%, then that's an indication, okay, there may be a speech sound disorder present and it's time to reach out to your speech language pathologist to get some more information there.
Okay, so how can this impact your child's communication, or what does this look like at home or even at school? So you'll see an increase overall in observable frustration, which can result in harmful acts towards others at school or at home. So this looks like hitting, kicking, crying, but it can also be towards themselves. It can also result in negative image of communication or dislike for communication and social interaction. So just refusals to answer questions or just participate in a back and forth conversation with you or with their friends, distant family members. This is just due to increased overall frustration and communication breakdowns over time. So these communication breakdowns can also lead to feelings of isolation, and again, just avoiding overall interactions with their peers or adults, just in anticipation of not being understood. So again, like Bailey mentioned, right? So if there's any concerns, just reach out to a speech language pathologist for an evaluation instead of just waiting to see if the issues will resolve themselves. We can help.
All right, so the question there, which we've kind of been touching on throughout, is how can a speech language pathologist help? So we've been talking a lot about the pieces of the puzzle that we use. If you feel like there is concern, you feel like something is off, I'm seeing them around all their other kids in their class or all the other kids at the park, and I'm having a harder time understanding my child, and there's these question marks there, then it's just time to go in and double check. This wait and see method is not something that we recommend based on a lot of the things that Chloe just talked about. We don't want them to decrease their participation in class. We want them raising their hand. We want them not feeling this isolation of, oh, I'd rather not talk because what if they don't understand me? So I'm just gonna keep my ideas to myself. Those are the things that we don't want to happen. So we want to encourage our children to communicate. So reaching out to your speech language pathologist to make sure we're not missing anything and that we are starting intervention if it's deemed appropriate. So for the speech therapist, it's really their role to determine first, is there a speech sound disorder present? We looked at that chart in the beginning where they're going to go through and do an evaluation and determine where do they fall on that category. Is this a motor speech sound disorder? Is this an articulation? Is this phonological? So they can diagnose that specific type of speech sound disorder. Then we can kind of determine that severity of impairment. How much intervention is needed? Can we do one time a week and get what we need, or do we need to give this child some extra support? And then as well, develop an appropriate treatment plan. So that, brings us over to the next box in green here. We're thinking about a lot of different things when we're doing an evaluation. The nature of the disorder, like I mentioned, articulation, phonological, motor, structural, perceptual, all of those things are taken into account. Are there other coexisting speech sound disorders present? So I'll treat a child that has an articulation disorder and a phonological, or we've got some motor issues going on here and phonological processes. So it doesn't mean they're always mutually exclusive. It's our job to really tease apart if there is a combination of speech sound disorders happening here. As well as language. So a lot of times language is such a big word and it's like, what is language? But if we have speech sound disorders, we don't want to miss a lot of times, how is their language development looking? If we can't understand them, do we know if they're developing the appropriate grammatical structures that we're expecting them to be producing at these ages? So we want to check in on language and make sure we're not missing something there as well. Cognition. So when we're thinking about, what's going on with the cognition, maybe these problem solving skills, these organizational things, we're looking at a lot of these different factors and how they're going to impact their learning in a speech therapy session. Stimulability is something else that we look at. Are they stimulable? Meaning, can they produce this sound in isolation? Okay, they can't produce the K or a G in their everyday speech, but if we start to cue them and get their tongue back, can they get that G sound out? That's something we're going to look at. Are they stimulable for this sound? So with some help, can they produce it? Social impacts. That's another thing we consider. Are we going to start treatment or not? Well, is this kid shutting down in class? Are they not participating? Is this impacting them in a social setting? Because if so, then I'm not going to want to wait and see. I'm going to want to jump in and make sure we get on the right track so that they're building up, all those other important factors, like self-esteem and feeling comfortable participating with other students, other peers. Motivation, we're looking at, are they motivated to fix this sound? So when we're thinking about home practice, homework, how can we support them if they're not motivated to practice at home? That's something we want to know so that we can support them in the best way possible. Resilience is kind of the last thing we noted there. Some kiddos may have a harder time being provided feedback of like, oh, I heard tootsie. And then that might feel like a really painful observation that we just made, that they might not like being pointed out. So we need to be careful and mindful of how we're providing feedback and how we're, again, supporting them during those speech therapy sessions. So our individualized treatment plans are based on a lot of different factors. And then we kind of pop over here to treatment approaches. So based on, the nature of the disorder, as well as, all these other factors here, it's really going to impact what kind of treatment approach we're going to pick. So I listed just some examples here: complexity, minimal pairs, cycles. These might be some words that you've heard your speech language pathologist throw out before and not know exactly what they're talking about. But these are all different types of treatment approaches, and we choose one or two or a small combination of some of these to treat every child. Again, how Hylan mentioned in the beginning, that it's about individualized therapy. Every kid is going to do different things with a different cue and on a different day. So we might need to be flexible in how we're treating these disorders. And so I just listed a couple there, and noting why my kid might sound similar or have a similar delay, but my speech therapist is choosing a specific approach. It's based on all of these kind of factors that I just discussed.
And then with those, we often give homework, right, Bailey? So we always give homework. You guys all know that. Whoever's watching, we know we give homework. So we wanted to, talk about how we can facilitate motivation and practice at home. So just really making it a part of your daily routine. We talk about this a lot too with our families. Just example, 10 to 15 minutes per day after getting home from school, or even in the car on the way home from school. We do it every day, and it's good for you because you're a busy parent. And then also it's a nice reminder to make it a part of your routine, so that way we don't forget as often. Overall, it's just really important to make it fun. So again, tailoring it to your child's unique needs and interests. So we also talk about implementing reward systems too, which it can also be put in place, which is always fun. Like sticker charts are a visual representation of just how many targets we've completed and look how much work we've done and how much progress we've made. And then we get to work towards a goal of like a desired object or food, maybe activity later in the afternoon. But just again, like Bailey briefly mentioned, positive feedback, that always really increases just overall desire to participate, right? So for example, just letting your child know, I love how hard you're working. That was a great snake sound. If you hear something, out of context, and when they're at home and talking to you about what you're cooking, oh, I heard a back sound. You said, oh, look, mama, you're cooking, right? So we just really acknowledge that they're working hard and they're really thinking about their speech sounds. And then lastly, practice at home is highly encouraged. And the more we practice at home, the faster we see progress.
Yes.
Making it part of your routine. I think that's something that's so important, such a key part of home practice, because if you think, oh, this is an extra thing I need to do on my to-do list, then it becomes a demand. It becomes a demand not just for the child, but for the parent. Oh, I have a million things to do, right? But if you know every time we're driving and we're in the car, this is speech sound time. It's just, we're already driving, so we're not adding anything new necessarily. We're just making it part of that routine. Every time we do bath time, that's our sounds in bath time. So So it's not needing to add another thing on your list. It's about finding what works for your family and where the best place to insert it in your day is. So if that's the car, if that's the bath, if that's meal times that we put, or snack time that we put each snack on each sound, and that's how we eat our snacks when we have snack time every day, then that's where we mean by putting it in part of your routine. It also helps make it fun, because the thing we want to avoid is for the child to feel like, again, it's a demand. This is the work. This is the homework. Because even that term homework, that can be taken negatively with some kids. It's just, let's have some fun and get our snacks out while we do our words. So keeping that fun is going to kind of keep that kid from feeling this aversion to practicing here. And instead, it's the time where you get all of mom or dad's attention with that awesome feedback and those clapping and the excitement that they're getting. And then we see a lot of kids love that speech time practice because it is all the attention all on them and it's a lot of fun. So trying to frame that mindset versus sit down at the table, we've got to do your homework for Miss Chloe, or we're going to tell Miss Chloe you didn't do your homework, right? That's going to be maybe not facilitating the most positive association with speech home practice. And then like Chloe mentioned, if we don't practice at home and we just do the 30 minutes once a week or 30 minutes twice a week, we're not going to see the growth that we would if we're doing a quick 10 minutes every day. That rate of progress is just going to, skyrocket. So it's really more bang for your buck to, instead of trying to double down, triple down on speech therapy sessions, just getting it into your daily routine is going to be the best way to make that, faster progress there.
Right. And almost a bonding experience with your child, right? So we get to make a fun sensory bin or something together. So it's less of a chore and more of just an activity that you get to spend time with your child, So sensory bins are super fun. All of our kids go bananas. They love these things. So we have beans, rice, water beads, pom-poms. We stick little figures or cut out pictures of our target words and throw them into the sensory bin and pull them out together with, you can pull them out at the same time, modeling for your child, showing the correct productions, and then also encouraging them to search for things and practice finding different objects. And that's really fun. We really like this activity. What was the next activity? Let's see.
All right, so scavenger hunts. So as you'll note that we probably, at least if you are a family that works with Chloe or I, you definitely get some printouts sent home with a whole bunch of little tiny pictures with the speech sound target on them. So these are not just meant to be drilled to just read all the pictures. Those are perfect to cut out, make copies, cut them all out, then put those little pictures in the sensory bin. Same thing, cut out those pictures and hide them around the house. So scavenger hunt is a really fun way to practice these target words. So cut out these pictures, hide them around your inside, in the backyard, whatever it may be, have them go and hunt for those words, find them, collect them. They can either get it and okay, say your word 5 times. Okay, now go get the next one. And then they go around and find all of their words. So you're using movement and some exciting game to really get them involved. So another great thing is putting them in Easter eggs or just those, those plastic eggs so that they find one. It's so exciting. We can put the egg in the basket and open them up at the end and practice all the words at the end. Or if we're really excited and we want to open the egg right then and there, then we open the egg and we say our word a couple times, 3 to 5 times, and then let's go find the next egg. So scavenger hunts are a great way to use those pictures, but in a fun, different type of way.
These are all really great activities for integrating what Bailey mentioned, right? Of those pictures that we send home all the time, the homework, right? So making it more fun, but also using preferred activities. So what's your child's favorite toy or favorite activity to play with at home, or favorite song to listen to? How can we use this and incorporate some of our speech sounds that we're practicing into these songs or these routines or these different activities that you use at home, or favorite character, right? Like if you're working on, let's see, if you're working on cat, right? We're still sticking to the back sound, or car. We can read a book with Pete the cat. And every time we see Pete the cat, we practice our back sound of cat, right? Or if we're playing with cars and that's our favorite activity of the time, we can practice focusing on those back sounds, car, or watch the car, let's go, right? So we're still targeting both of those back sounds, but while we're playing, so it doesn't feel so much like work or drill, but just more like play. That's going to be our key here as well.
Yeah, I think Chloe, you today came in my office with one of your kiddos and you were like, we've been talking about the Paw Patrol puppies and what he's working on SK blends. And she was like, who's the girl that wears pink? And she gave us a perfect Sky.
Oh. And he did it 10 times really fast, which is awesome.
He did, and it was beautiful. So loves Paw Patrol. A lot of our kids love that. Songs, if you pause the song and then we practice that, that word, or we want to tell them to go to turn it back on, we can use the pausing of the songs and these highly preferred songs to get to continue that preferred activity. So anyway, using those characters, being creative, thinking about what they like the most, and telling your speech therapist he loves this show. We are professionals at finding ways to incorporate speech sounds into fun activities.
Let us know what you like. Let us know what your child likes.
So let us know what these preferred activities are, these preferred characters, and we'll help you with some of those ideas. So next we've got board games. So we do lots of board games in our speech sessions, especially with some of our older kids that can maybe tolerate getting 50 to 100 productions done. We can use these board games to really get a lot of repetitions. So for example, you might have your child say the word 5 times, and then they get the sword to put their, sword in the pop-up pirate. Maybe they say their word, then they get to put the fish inside the shark's mouth. I use the speech sounds to set up the game. So for the shark bite, they have to, first you're supposed to put all the fish inside the mouth before you go fishing. So I use the setup as each time they're putting the fish in, we're practicing, as well as when we actually get to go fishing. So we use, and it can last, one game of shark bite can last the whole 25 minutes with 100 productions of one, speech target done by incorporating those speech sounds all throughout each little step. So if you don't skip over board game setup, make that part of it. So all these board games are great. Also, you can use toys like Legos, puzzle pieces, those magnetic tiles, anything that has little manipulative pieces that they need to build on. You, instead of giving them the whole box with here's all your Legos or here's all the magnet tiles, maybe mom or dad keeps that box, and then they, for every production, they're getting a Lego, they're getting a magnet tile as they're building their beautiful castle. So think about holding on to those prized objects and earning them as we go. So again, making it fun, keeping it motivating. They're doing something or building something awesome while getting in that speech practice.
Okay, so another fun thing that we like to do in our office is incorporate movement into our sessions. So instead of sitting and using drill base, if I can tell my kids getting really antsy and wants to move around, we had a lot of ice cream before we came to speech to see Miss Chloe. It's okay. We're going to move around a lot together. And that way we're not just sitting and making him focus on, let's just get these words done and then we get a prize, right? So we really like to incorporate some movement. In the office, we have a scooter board that I really like to use with bean bags or a bucket. So we have to say the word 5 times, then we get to throw the bean bag into a bucket, or we get to scoot back and forth from one side of the room to the other. After we say the word 5 times, and we get to go and do it again. So, or we can even sit on If you have a peanut ball or anything at home that you use for your workouts or whatever, those usually help just kind of really facilitate that movement and refocus the activity onto something more fun and but still getting our target words done at home. So those are, and again, ask your SLP how you can do it at home, or ask if they can provide you with any other ideas with the things that you have available in your house.
So for these kiddos, I like to think of the parents that, or, the kids that come in that are wanting to jump, bouncing off the walls, running from place to place. They're ready to go. The thought of sitting in a chair is like torture to them. The thought of having to sit down and do something is just like the worst idea in the world to this child. Then that's a perfect kid that the light bulb goes off. Let's just use movement. Let's go in the backyard, and we're doing our sounds every day for the time we're going to be in the backyard. So it's not about being in one chair. It's not about sitting down and hyper focus necessarily. It's about getting movement in, which can help a lot of our children focus. If we're feeling dysregulated, our body's feeling dysregulated, we need that movement. We need that movement to stay engaged and to focus. So incorporating movement for that kind of profile of child is going to be the best way to practice your speech sounds. So that's, if you're thinking my kid is not going to sit down for 15 minutes and do this, we're not expecting that. That's a perfect opportunity to move and to throw things, to run, to go down slides, to climb. It's a great way. You're just finding ways to incorporate it into that movement activity. So that's just kind of a note there. And we can go on to some other fun activity ideas. The ones we talked about were ones we use on a daily basis. Here are some other things that might work for you guys at home. So I kind of mentioned that those, we usually print out little or send home papers that have a whole bunch of different words on them with their target sounds. Put a cracker on each one of those. And so snack time, they get to eat. Every time they eat the cracker, they say the word underneath 3 times. And they go through and they have their whole little pack of goldfish while practicing speech sounds. So that's our snack time routine. Record and watch videos. Kids love to look at themselves on videos. And so get out your phone, record the video and let them watch it back and say, oh, did you hear that snake sound? That was so cool. So watch them, let them hear themselves be successful. That's a really great technique. It also can give them feedback if maybe they missed the sound or they didn't produce it right. Watching it back to be able to provide themselves with their own feedback can be a really helpful activity. Snapchat filters. Kids love those Snapchat filters. So let's do our snake sounds with some bunny ears on our head during Snapchat. That's all super fun, super motivating. I think Snapchats are an awesome idea to do at home. Giving toys names with target sounds. So maybe they've got a little toy at home. Chloe mentioned using preferred characters. Well, maybe they got a brand new stuffed animal. Okay, well, let's think what kind of name we might give this stuffed animal, and we can give them some fun options that include their target sound. Taping pictures on the wall is a really fun thing. You can cut out those little pictures, tape them up on the wall, turn off the lights and use a flashlight or a laser pointer to highlight which one they want to practice. It incorporates them, and it's a really fun way to encourage them to be engaged in this activity. Emptying a tissue box and putting the pictures inside so it becomes like a mystery box. And let's put our hand in and, oh, I wonder what you're gonna get. Let's find out. And then they pull out their picture and see what they get. The element of surprise for some reason is just the most exciting thing in the world. Even though it's just a picture with their target sound on it, that's a great way to practice using those little homework pictures. Coloring pictures of target words. Maybe your kiddo loves to color. Let's print out some pictures or ask our speech therapist for pictures that has their target words. So a lot of times we have colored pictures. We can also print them in black and white. So if your child loves to color, let us know and we can print out those black and white so they can color those. Playing I Spy to spot a target or word with their target sound around the house. So I Spy is a great one. You can do it in the house, you can do it in the car, things like that. I Spy is a good fun little way to incorporate those target sounds there too.
So all in all, those are so many amazing activities. And I know that it's easier said than done, right? So when all else fails, we like to choose words that our child is going to be motivated by, right? But that still are a part of the target. But then we can also go back to that activity, PowerPoint slide, right? And then just really think about different ways that we can really make it fun. So like, again, I know we keep saying this, but just really focus on favorite characters or toys. So like if your child's working on S-Blends and loves Spider-Man, talk to your therapist about maybe integrating, Spider-Man into one of their core words or one of their more functional words. And so that way it's a fun activity for you guys to implement at home. And then it's also great to start small by targeting just a few words at a time, right? So just depending on what your child's tolerance for target practice is, you can start as small as 5 words one time a day, and then slowly increase their endurance or the longer duration of practicing speech sounds as time goes on. We don't have to start really big with 25 words all at once. We can start with that small amount and work our way up. And then again, working on or incorporating a reward system, right? So first, then language. I love this one. First, we practice 10 words, and then we get to go play outside. That's usually really motivating because we know that there's an ending point, right? And then we get to do something that's preferred after. And it's always fun to invite family members. Grandma, grandpa are visiting. Ooh, let's take turns with grandma and grandpa. Or let's enroll the siblings, right? Enroll a brother and sister and see if they can do it too. We always love a good challenge with brother and sister, right? So then we also have take turns being the teacher. Let them provide feedback on your productions too. And just lastly, again, let your therapist know that your child's being resistant at home, and we'll find a way to implement something really fun and that meets your child's unique needs, and we'll work on a possible resolution together. And I think that's it.
Yeah, the only
Yeah.
thing I wanted to add, which I really like, is the giving feedback when all else fails. Like truly, like I've had parents come in and say they just won't do it. Like I have tried everything, they just won't do it. Then we can at least bring awareness to that sound by, okay, you don't have to do it. It's not your turn. It's mommy's turn to do it, and you're not allowed to say it. Only I can say it. Okay, and then they have to listen to you produce the sound, and they can give you where Chloe mentioned providing that feedback to you. So if we're working on sky, and they're dropping that S, and so okay, mommy's turn, I'm gonna say that puppy right there, that Paw Patrol puppy, and we say guy, and oh, did I do it? Oh no, mommy missed her snake, I gotta try it again. Sky. All right, so that he or she does not even need to be using their voice. If they are refusing and they're showing some serious aversions and they're frustrated, then just letting mom or dad take their turn and be excited about it. And they're the teacher of like, oh no, you missed your snake on that one, mom. So let them be the teacher, and just talking about it, bringing that awareness there, that's going to do more for our child than just, dropping it all together. Then maybe we'll put it more on us as the parents or the caregivers there to be good models, and taking a little bit of that pressure off of our kids until we can foster a little bit more positivity around it, until we're really ready to start producing it on our own. And definitely letting your speech therapist know is kind of the key there, that we're having a big pushback at home, and kind of taking some of that pressure off of them. And I wanted to know, one of the questions we did have in the chat was, when can you start board games? Start with board games, like at what age? Great question. So I really like Pop Up Pirate. You can pretty much do at a very early age. 2 years old, they're 2.5, you can give them a sword, they can push the sword in, and then when the sword goes in, the pirate pops up. It's really kind of like a cause and effect in a lot of ways. All they have to do is put a sword into the little slot. They're not having to read cards or participate in that. So pop up, pirate, shark bite, those are Pop the Pig. Those are some really early board games that you can start introducing. Maybe around that, 2.5, 3 years old, they might get really into some of those things. If they're a little bit younger, 2, then maybe you want to start with some more of that movement-based type things, incorporating it.
Like cause and effect, right? Like that pop, like once I get to a certain point, I know that this thing is going to do something, right? So like all those toys have that in common, but like board games are like, are we talking like Candyland? We just need to have that, that cognitive function, and that's usually when we get a little bit older, right? Because I feel like a 2-year-old or 3-year-old is going to lose focus when we're playing something that requires like those cards or rolling the dice, being able to understand, oh, how many do I get to roll? I don't. So there's lots of rules. It's implied that maybe we should wait until we have that cognitive function versus like those cause and effect. Those are super fun because we can see that relationship. Sorry, now I'm distracted in the chat. But amazing points, Bailey. You rule.
Thanks, Chloe. Yeah, shark bite, pop up pirate, pop the pig. Great early board games to start if you're thinking about how do I get my kiddo started on some board games. Those are great. As we can kind of move up from there. There's matching games like sneaky snacky squirrels, where they can spin, and whatever color they land on, they get that color acorn. That's a great one. Then we can kind of think about Zingo, where they're matching a picture to a picture. Zingo is an awesome one. It's kind of like bingo, but they get those picture cards and they fill it up. So Zingo is an awesome one.
Bear game.
Which one? Yeah,
the new bear game. So the bear's asleep, and then you have to push his tummy a certain number of times, and then you steal from him every time you push the button and he doesn't wake up. And then if you push his tummy too many times, then he wakes up. So it's really motivating to get those speech sounds in, because we want to push his tummy as many times as we can to see him pop. It's cute.
I'm just going to pop in for 1 second. Another very easy, great activity is bubbles. Bubbles are magical for everything, whether it be language, articulation, whatever you're working on. And so, every time you pop a bubble, maybe you pick a word, or maybe you say 5 words and then you blow more bubbles, and then your child gets to blow bubbles. And that's something that I feel like every family has laying around the house as bubbles. So even 10, 15, 20 minutes of bubbles flies by because it's so fun.
Bubbles are gold. That's a very, very, very good suggestion.
Any questions? I don't see any more other than, Miss Chloe got her nails done.
I know, it's so cute. Bubba's not here. He's not here anymore, but that's so cute.
Oh, that's adorable.
He'll probably bring it up tomorrow.
So if no one has any more questions, I just want to thank you all for attending. As you can see, Bailey and Chloe are both fantastic therapists and very passionate and love what they do. We're very fortunate to have them on our team and very lucky to have them presenting to everyone tonight. So thank you so much, Bailey and Chloe, for all you do. If you have any questions, you can reach us on our website. You can always email us. I'll put my email in the chat box in case you have any questions regarding any sort of onboarding questions about scheduling. I'm more than happy to help follow up with that. Like I said, we are expanding our North County facility as well. And so we are adding more therapists there, which we're really excited about. And then we're also expanding in Kearney Mesa. We're expanding in National City. So any questions that you have, you can contact us, and I'm happy to follow up and answer any clinical questions that I can directly with you as well. So thank you so much for coming.
Thank you, everybody. Have a nice rest of your evening. Thank you.
Have a good evening.
Everybody.